Good evening. Welcome to Instagram Live tonight with Raka Strong and Dr. Asula. We're just going to wait a couple of minutes before we get started. So thank you again for everybody who's joining. I am Tracy at Raka Strong and look forward to tonight's conversation on breast cancer diagnosis and imaging in African American women, as I feel this topic is so imperative to talk about. And as we're closing out Black History Month, I think we need to raise awareness not only this month, but every day to make a number difference in our society, as numbers are so much higher for African American women than they are for white women and the mortality rate. So thank you everybody for joining, and Dr. Asula will be on soon. So good evening, everybody. Thank you again for joining. Good evening. Thank you so much for joining.
Thank you so much for having me.
So what we're going to do is we're going to go ahead and get started. I'm going to do a short introduction and then I'll pass the mic over to you. So for those of you that don't know me, I'm Tracy Posner, the founder of Bracket Strong, where we alleviate emotional and financial burdens of women facing breast and ovarian cancer, regardless of predisposition, through advocacy, direct assistance, empowerment, and events. So we are here for you as a sorority that nobody wants to be a part of. So thank you so much, Dr. Asula, for coming on and taking the time to speak about breast cancer diagnosis and imaging in African American women. As I said prior to you coming on, it's not only Black History Month, but it's so imperative, as 40% of African American women are at a higher rate, and to die with this diagnosis, and doing the right imaging and following the right processes. So I really appreciate you coming on. And for those of you who don't follow her, please follow her Instagram. And we look forward to tonight. So thanks so much for your time and dedication.
Thank you so much for having me. I am so happy to be here. It is so important to have this discussion. So thanks for sharing the platform.
Perfect. So if you want to go ahead and do a short introduction, and then we can get started and talk, a little bit more why it's so important for imaging in women today in our society, and not only African American women, but in general. And then let's talk about maybe, the different numbers and the processes and why women need to be more aware of their body and know their options.
Absolutely. Good evening, everybody. Thank you for joining in. My name is Islamiat Ego-Osuala. I am a board certified breast imaging radiologist. I practice mainly in the DC, Maryland, Virginia tri-state area. I work with a private practice group called Washington Radiology. Great group, and I truly enjoy what I do. I specialize in the diagnosis of breast cancer by interpreting images, whether it's mammograms, ultrasounds, or MRIs. I also do diagnostic breast procedures that would help treat and also just diagnose breast cancer. So biopsies, we do them as well. I am also the founder of the Minority Breast Report, which you said earlier. If you have a chance, go check out the page. I have so much information about healthcare disparities, particularly how it has to do with Black women in general. So thank you for sharing the platform again. I'm so happy to be here.
No, I've learned, in the state of Florida, I learned recently that 30% of women are not screened. And, when this came up, this is before like a couple months ago, and it just brought such attention to me to say, here we are focusing on education, but what can we do to take that education to the next level and really get our voices heard? And especially, hearing the percentage difference or how high the mortality rate is really was mind-blowing to me. And I said, we need to get on this once a week and talk about the mortality rate and what we can really do and guide women, because just because you can't afford a mammogram doesn't mean you shouldn't get a mammogram. Because you can't get an MRI doesn't mean you shouldn't get an MRI. And women need to know that there's funding out there for all of this. There is somewhere in your state that will be more than happy to get these done for you.
Yes, and in addition to that, breast cancer is now the most common diagnosed cancer in the world. That just happened. So this is something that needs to be addressed as soon as possible. The numbers are terrifying, and we just need to gain that control and empower ourselves with that information.
Do you think that COVID has an impact on that?
Absolutely. At the height of the COVID pandemic, a lot of the healthcare facilities halted doing non-urgent procedures. Screening mammograms are part of that, right? Because we want to help, mitigate transmission of COVID, and we also wanted to preserve, PPE for the frontline workers, right? So the thing is, we have better knowledge about COVID now. We know more about its transmission. We know how to keep people safe. So all those patients that were not able to be screened, a lot of them are returning, which is the good news, but we're still definitely missing a lot of patients that are supposed to get their mammogram. And, and I do understand, like, people have obligations. This is a very difficult time for a lot of families, childcare, virtual learning. I have kids. I can really, relate to the difficulty, but we always have to realize that we can't help anybody if we're not healthy, right? If we're not alive, if we're not healthy, there's no way we can help anybody. So it is absolutely important for us to still take care of ourselves during this period.
One thing that I constantly remind all of our women is, breast cancer doesn't quarantine, right?
Right? Breast cancer does not care about COVID or quarantine. At
Right.
100% correct.
A question, as the pandemic's going on in COVID-19, but what's at stake for Black women, like during this pandemic?
Because of the disparities that exist with Black women, for example, Black women are 40% more likely to die from breast cancer in terms of mortality rate, right? We tend to get the more aggressive kind. We're more likely to get that, which is the triple negative breast cancer. We also have a higher likelihood of having genetic mutations such as the BRCA gene, less than white women of Ashkenazi Jewish heritage, but still higher than other ethnicities. So knowing all of that, early detection saves lives. The only way to really help and just put everything in our favor is just by making sure that we go and get our screening mammograms, because we do not want to delay diagnosis. We do not want to have any misdiagnosis. So it is so important that, we get out there and do this, because there is so much at stake for Black women.
Maybe we can touch base on, a lot of women are like, oh, I'm not 40, I shouldn't have a mammogram. Talk about your family history, right? Talk about your genetics, like where it stems from. And, I think that plays a big role too, where a lot of women don't realize, your ancestries or your family history really plays an impact on your screening as well. I've heard in the past, obviously we had this conversation the other day, that you should get tested 10 years younger than your closest family member that was screened. And I feel like a lot of families don't talk about family history.
Yes. And that
So
is an issue. Yeah. Go ahead.
somebody asked, does Black women carry the BRCA gene?
So like we just said, they do carry the BRCA gene, more likely than our white counterparts, but still less likely than, white women with Ashkenazi Jewish heritage. So yes, we do.
So with these disparities in mind, how does the current breast cancer screening impact Black women? There's different, obviously, it changes, right?
Yes, it does. There's so many different screening guidelines out there, and that can add to the confusion, because most people are like, should I start at 40? Should I start at 50? And I just wanted to say that, the guideline that has been heavily researched and has been shown to, give the best mortality benefit is the American College of Radiology guidelines, which is the one that we also use. Is basically average risk women should start their screening mammograms at age 40, and it should be every year. Now, if you're a higher risk, then you might need to start earlier. But no later than age 30 should you get a genetic risk assessment. You want to talk to your physician about your family history, possible genetic mutations in your family. If you've had chest radiation as a younger child, that's another risk factor for breast cancer. Dense breasts, you do want to talk to your physician about getting a genetic risk assessment so that they can, decide whether you're one of those people that needs earlier screening mammogram instead of waiting till age 40, because that's where we know that we can save the most amount of lives.
Somebody posted, is a self-exam a secured way to detect breast cancer?
No,
One thing, I'd really like to say is we all talk about self-breast exams, and if we do them, we need to make sure that they're not 5 minutes long. They're time consuming. They take once a month, take your half hour and do a self-breast exam. Know your body. I will pass it back over to you to relate, but know your body and make sure that you know the differences. Make sure you do all your movements and your rotations when you do these. You don't just go like this really quick. It's something that takes
Right.
time. And I think that a lot of women are also being misdiagnosed or not caught because we're told, oh, it's 5 minutes for a self-breast exam. I don't think so. Do you?
No, I do not think so. And, self-breast exams should not replace screening mammograms, because you don't want to wait till you can feel something before, you have it detected, right? So they are very useful, self-breast exams, like you said, once a month. If you're still having your menstrual cycles, do it about 7 to 10 days from your menstrual cycle. This is the time period where you're the least tender and also not as much lumpiness. And pick the same exact time every month. If you feel something, don't panic, okay? If you're still having your menstrual cycles, wait another cycle to see if it disappears. If not, then call your doctor's office, because the truth of the matter is most of the things that you feel on self-breast exams, it's not cancer. But at the same time, you should not neglect them. The point of self-breast exam is just to increase your self-breast awareness, right? It is not necessary for you to be able to say, yeah, this is cancer. No, you just need to know what is normal for you. And then so that if anything changes, you have that awareness that, what, this is not normal for me. I need to have this checked out.
For women who had mastectomies, right, or laterals, are we supposed to still do breast exams? Are we
When
supposed
you
to
do
feel? Mhm.
When you do have mastectomies, they cannot take out 100% of the breast tissue. There are still some residual breast tissue. So it is always a good idea to know what your baseline is, right? And you do have to know that when you do feel something, it's not always a recurrence. You could have something called fat necrosis, which is a common post-surgical finding. And just basically during the surgery, they work around in the fat and it gets inflamed. So yes, get to know that, because you might be able to pick something or not.
What can Black women do to decrease their risks for breast cancer?
So when it comes to risk factors for breast cancer, we have the modifiable and the non-modifiable risk factors, right? The non-modifiable risk factors are the things that we cannot change. We cannot change our gender. The fact that we're female puts us at an increased risk. We cannot change aging, as much as we all want to look younger and feel younger. We cannot change our age. We cannot change, family history, genetics, things like that. But things that we can do that are within our control is, like, for example, diet, okay? Maintaining a healthy weight is always a good idea. Physical activity, and, just basically also doing what you're supposed to do in terms of screening, doing also your self-breast exams. These are things that can help, empower you, and also decrease your risk for breast cancer.
What can we do to educate our healthcare providers on the disparities, not only during the pandemic, but just in general? Like you said, we can go to our OBGYNs, we can go to, different physicians who do genetic testing or talk about breast cancer, but what do you think we could do to educate these physicians more on the
Yeah.
disparities that we face.
And it's just basically starting with what we're doing right now, having these discussions on public forums and talking about the screening guidelines that do have value and letting that and, empowering our healthcare providers with the information to share with their patients and tell them that there is value in getting your mammograms done at this certain time period. We also want to encourage our healthcare providers to be also, communicate more with our patients in terms of, getting to know their family history, etc. Any kind of providers that practice in Black communities, they should also be more culturally competent because so that we don't have gaps in communication. Just because I'm saying something doesn't mean the other person understands it, and vice versa. So knowing how to deal with language barriers, that's another way for healthcare providers to be able to help their patients. Also, just healthcare providers, taking that extra step. If you can ever expedite something for a patient, that is a blessing. If you see a patient today and you see something that is suspicious, if you can add that biopsy to your schedule and do that biopsy that same day, you're saving that patient an extra visit. If you know breast surgeons that can help a particular patient, go ahead and make that phone call, in order to just help our patients, get the better treatment, because we know that Black women are also more likely to have delays in terms of follow-ups and treatment. So we need to really help break those barriers down.
As we are talking about all different diagnostic testing, a lot of women get scared when we go for mammograms, right? And you get called back for an ultrasound. Do you think, first, obviously, maybe we could touch base on, why we have to go back? And then, is there a way that we can eliminate that? Like, for example, when you see your breast surgeon or you see your OBGYN that orders your mammogram, do you think that there could be less stress on women by saying, order a mammogram and an ultrasound based on your history or based on like something in the findings, instead of saying like, a lot of women, oh, I have to go for a mammogram. And then like 3 days later, they get called back. Oh, well, now you have to go for either an ultrasound biopsy or an ultrasound, to find out more. And I hear so many different, obviously, good
Yeah.
stories and horror stories, but I hear more horror stories. And I think the stress that it causes, like we say, scamxiety, right, for women, do you think that there's a way that we can help change that, or maybe talk about it so women understand, we don't always have to panic, right? Like a lot of us tend to say, oh, wait, we have to go back for a scan. But really, getting that quality image, I think is so important. Recently I underwent an MRA and I had to go back for insufficient quality. We don't want to hear that, but really when we think about it, I think we're better off hearing that than just letting the unknown be it, right?
Yes, yes, you're 100% correct about that. It is very difficult to have everybody that has some kind of a family history or has a history of breast cancer to come in for a diagnostic mammogram, which is basically where you actually physically see a radiologist and you get your answers the same day. But like you said, it is okay to get a screening mammogram. If you do get called back, it could be for multiple different reasons. For example, quality issues, we call those technical callbacks. And all we just want to do is make sure that everything is up to the standards that are, mandated by the FDA and NQSA guidelines. There are also some callbacks because we see something, and more times than ever, these things actually turn out to be benign. And most times it's either, tissue overlapping each other or a cyst or a fibroadenoma. The other times that we want to pursue things, we can go into ultrasound and, we might recommend a biopsy, and even most biopsies come back as benign. So I completely understand the anxiety that goes through people's mind when they get called back, but it's so important to stay positive and just know that the anxiety is transient, okay? Because once you're done, you're fine. You know that you're doing what you're supposed to do. Your breasts are fine. And, even if it turns out to be something that nobody wants to have, you're doing the right thing by finding that diagnosis, empowering yourself, and then you can take the right steps as to treatment.
Some women also ask us questions on like, why do I have an MRI versus a mammogram? Like, maybe you can relate a little bit on like what the difference is between the screenings.
Yeah, so mammogram is the gold standard for screening, and that is what is used for all women in terms of screening for breast cancer. Now, there are certain patients, like patients that are higher risk, that would require additional screening, and that's when you can use either a screening ultrasound or MRI. Now, mammograms, however, can be limited depending on the density of your breasts, meaning that it's harder to see through if you're dense. And so sometimes, especially this higher risk patients, it might be very useful for them to get MRI as well, which doesn't have any density limitations and is also more sensitive. Although MRI is more sensitive, it has more false positives. That means that you start to see things that would turn out to be nothing, but because of the fact that you have to pursue them, do biopsies, that can be a little bit, much and not as cost effective. So that's really the difference between, mammogram and MRI. MRI does not replace mammogram unless you've had maybe a mastectomy. But mammogram is the gold standard for screening.
Now, you talk about dense breast, and that's another question that comes up all the time. Maybe from a radiologist standpoint, if you can explain a little bit what it is to have dense breast.
Yes. So density of the breast or dense breast is not something that we can physically see. It doesn't matter if you have big breasts, small breasts, perky breasts, or flat. It doesn't matter what it looks like physically. It is actually something that we see only in mammogram. And basically, mammograms are black and white images. They're X-rays. The white in mammograms is your true breast tissue and the connective tissues and everything surrounding it. That is the whiteness that we see. The blackness we see is the fat. So the more white you have, the more dense you are, because cancer is white and your breast tissue is white. So if you're really white, I can't really see behind all of that as well. So that's what dense breast has that's what it is all about. But it has nothing to do with, what the breast look like physically. It's not something that you can see or feel on clinical exam.
Perfect. How does breast cancer affect Black women differently than white counterparts?
There's so many ways that I think we both know how breast cancer affects Black women. Unfortunately, most of them are negative impacts, right? I know Black women tend to get diagnosed at a younger age compared to white women. About 23% of breast cancers diagnosed in Black women are actually diagnosed before the age 50. That Black women are more likely to get the aggressive triple negative breast cancer, which is associated with a faster growth, faster spread. Black women, we said, are more likely to have genetic mutations that can predispose to getting breast cancer. Um, Black women are 40% more likely to die from breast cancer, even though Black women have a slightly less incidence of getting breast cancer than white women. It's about 12% to 13%, but we're still 40% more likely to die from breast cancer, which still blows my mind every time I see that. And, these are all negative impacts. I really can't come up with anything positive, and I try to look and see what is it about our race and ethnicity that, has any kind of positive impact in terms of breast cancer. And I really couldn't find any. So, and that's
And
why the American,
we were talking about, even clinical trial enrollment in African American women is so low. You know,
absolutely, Black women are underrepresented in clinical trials for breast cancer treatment. That is, a serious issue because, even though we are more likely to get the aggressive triple negative subtype that would most likely need some of these, experimental drugs, we're still the least amount in terms of participation. And that just blows my mind because how do you know what works for Black women if you're not including them in your trials or you're not really seeking them in your trials? So
If you could give us 2 or 3 takeaways today that, somebody, our listeners can take away to their family and friends. I think it's so imperative that we talk about this more. We share posts, and explain to women and make them understand and give them their resources and let them know there are resources out there. Our families, years ago, different cultures didn't talk about, breast cancer. That really there wasn't anything on genetics. But, just knowledge is power. Know your options and make sure that you're screening yourselves. I know from a standpoint of BRCA Strong, we are going to make an impact, and especially on African American women, we will be doing events and pushing more towards screenings for them to be able to make sure that we can fund them and help them and guide them through their process. Because if our families didn't talk about it, we're kind of in the dark. We go into isolation, but really we're all here to support you as a sorority and be together because we want to make those numbers drop. We want to see clinical and trials, growth in African American women. So there's more treatments and there's more options. Knowing your options is half the battle.
Absolutely.
Tonight, as we're closing out, I would appreciate it if you could give us again, like 3 takeaways to share with the community. And I hope to all of our listeners and our followers that are going to listen to this video, share the takeaways with your family and friends. The only thing we could do by making a difference is sharing. Social media has such an impact on our lives. Everybody's on their phone all the time. Make sure that you're reposting and you're posting true facts, making a difference and touching on areas that are needed, different disparities, different ethnicities. Ashkenazi Jewish women have a high rate of, breast and ovarian cancer and different mutations. And it's not only BRCA, like you said, there's PALP, how many other PALP B2, right? I mean, there's across the board. It blows my mind. And I can tell you, I was diagnosed 10 years after the BRCA gene was founded. And to me, the difference in research and technology and advancements are like, whoa, like it is mind blowing. So I know that if we can make this difference, let's continue on for 2021. Let's choose a day of the week. Let's post on African American Black women. Let's make the difference in our community.
Yeah. So basically takeaways, the biggest thing that a lot of physicians say, especially breast radiologists, we say is early detection saves lives. I'm sure you've seen that hashtag everywhere. When you talk about breast cancer a lot, it can be kind of morbid and kind of depressing. But honestly, the reason why we're having this conversation and talking about this is because we want to empower you so that you're not fearful that you're going to die just because you're diagnosed with breast cancer. There are so many breast cancer survivors. A lot of the instinct that we have is once we're diagnosed, we don't want to tell anybody, right? We want to keep it to ourselves. Whether it is, you don't want to tell your family because you don't want to break their hearts, or because you feel ashamed, or you feel like, you have something that would make people treat you differently, forget about that. If you are a breast cancer survivor, if you have a family history, if you have the knowledge, the voice, the platform to be able to share information that will save lives, please do it. This is the only way we can get it out there and break down these barriers and these disparities. Do not hide yourself, share your stories of success. Share your imaging stories, share how you found your breast cancer. If you found a lump, if not, if you just went for a mammogram and they saw something, the more people know about the process, the less fearful they will become about it, and they will become empowered by it. So that is really honestly my takeaway from this. I really admire what you're doing. You guys are doing such a great job. You advocate, you donate, you educate, you empower. Kudos to BRCA Strong, and I'm just saying, good job.
Thank you so much. I really appreciate it. And I appreciate your time and dedication. Everybody that's on the call or listening, make sure you guys follow the Minority Report on Instagram, always posting, updated information and just sharing and making sure that we make a difference. But as we close out tonight, I'd like to remind everybody, we went live yesterday on our new website. We have some amazing new programs to help women. If you or your family member needs any support, please feel free to reach out to myself or any one of our board members, and look out for the new programs that we have coming that we'll be sharing this week. And thank you so much again for your time and dedication. We really are grateful and appreciate it.
Thank you. Have a good night, Tracy. Nice
Perfect. You
talking to
too.
you in person.
You too.
Bye.
Take care.